Get ready to listen, learn, and earn CE hours. This podcast features content from an accredited CE activity provided by Colibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits.
This is Dr. Candace Pierce with Elite Learning by Colibri Healthcare, and you are listening to our Elite Learning podcast where we share the most up-to-date education for healthcare professionals. Welcome to the Functional Medicine Shaping Holistic Care podcast. In this series, we are going to look at the latest trends and practices in functional medicine. And we know that functional medicine is becoming more popular because it really emphasizes treating the whole person rather than just the symptoms. Functional medicine is also opening the door for healthcare providers to deliver more comprehensive and personalized care, really addressing the root causes of health issues rather than just managing symptoms. Understanding functional medicine is going to enhance your ability to improve patient care outcomes, promote long-term health, and really collaborate more effectively with other healthcare professionals. Joining me for this discussion is Leah Gagan. Leah, thank you for joining me.
Thanks for having me, Candace.
Yes, absolutely. I'm really excited to learn how this approach differs from conventional medicine and those key elements that ensure patient-centered care and why it's important to focus on root causes. So hopefully we'll get to share some specific examples where these approaches have led to significant improvements in patient outcomes. So Leah, how did you get into functional medicine? What really opened that door for you?
So when I first graduated from nursing school, 10 plus years ago at this stage, I started my career working in the emergency department. And I absolutely loved working in the ER. I can stay very calm under pressure. I loved working as a team. And I loved really understanding the full spectrum of disease, seeing people when they were acutely ill, understanding what those acute care interventions were. But unfortunately, in America, many people will also use the emergency department as primary care. And I just started to notice this pattern of people coming into the ER for basically managing chronic illness, which we weren't really equipped to do well. And we were prescribing a lot of medications to manage symptoms without a lot of education and follow-up for these patients. And I became frustrated and burned out over time with this more reactive form of medicine because I really went into healthcare to help people heal. And when I
Right.
first heard and learned about functional medicine, I just had this light bulb go off in my head because I really saw that functional medicine was a pathway to help people truly heal at the root cause, where they wouldn't need to take medications or even engage as much with the healthcare system over time because they understood how their bodies worked and were able to balance things at that source.
Mm-hmm. Absolutely. So going into that, how does a patient-centered approach in functional medicine differ from that conventional medicine that you're talking about?
Oh, yeah, good question. So, under the conventional model of care, we place a lot of emphasis on evidence-based care. There are a lot of protocols and studies that have been done to basically help us understand how the general population will respond to different treatments for certain conditions. And don't
Mm-hmm.
get me wrong, there's definitely a time and place for practicing medicine that way. As a former acute care nurse, I really do understand there is a time and place for acute care interventions, but with functional medicine care, we basically use evidence-based practice, just like conventional medicine, but we also include patient preference as well as provider expertise in our locus of designing a personalized treatment plan for our patients. So it's a lot more individualized. It recognizes how someone's unique genetic profile, their environment, as well as their diet and lifestyle practices can actually influence their health and taking those things into account when caring for somebody. And it makes it actually really fun as a provider as well, because you can see patients who have the same root issue, but you actually treat them all slightly differently depending upon their preferences and depending upon what their testing is showing you.
Now, would you consider, I know we say conventional versus functional medicine, but would this be kind of considered more alternative, or does it still fall in the realm of conventional medicine where insurance pays for the treatments?
Yeah, good question. So, um, unfortunately, right now, with the way that our insurance model of care works, there's no way to directly bill insurance for functional medicine care. And the reason why is because with functional medicine care, we really value spending unhurried time during appointments, getting to know our patients, asking questions, basically weaving this timeline of somebody's history all the way back from when they were born through their present day where they're not feeling well. And the average primary care visit that insurance will cover is around 15 minutes long. So it really just is not enough time to get deeper into somebody's history to really uncover these connections. Um, and it's unfortunate because it does create a barrier to care, at least at this stage of the game, for people to access functional care. And that is something that I'm really passionate about and something I'm trying to weave into my own private practice too, is trying to get this knowledge and this wisdom to as many people as possible in a cost effective way.
Absolutely. I love that you're trying to advocate because this really is a great approach to care, and it should be covered. It should be part of healthcare options. So I love that you're advocating for that. So going back to functional medicine, what are those key elements that really make sure that it's a patient-centered care approach in functional medicine?
Yeah, really good question. So, we value quality over quantity, first and foremost. So, in the insurance model of care, conventionally, you have to meet certain quotas of the number of patients
Hmm.
you see in a day for reimbursement for your practice. In functional medicine care, we take care of a smaller subset of patients at any given time, which allows the providers to really give those patients their undivided attention and to allow more spaciousness for a relationship to develop between providers and patients. And that is really the core foundation of healing from what I've experienced in care is basically giving somebody your undivided attention, listening to
Hmm.
them, reflecting back what they're sharing with you so that they really feel like they're being heard is really the foundation that healing can build from. And on the flip
Absolutely.
side, on the practitioner side, it's also really helpful because providers are burned out right now. They're seeing 20, 25 people in a day. They're taking their notes home to try and finish in between shifts and things. And with the functional model of care, at least that we've built here at Emergence Health, we really have a smaller subset of patients that people can care for so that they feel really well supported and the practitioners really feel like they're providing the type of care that they really want to their patients. So that's a big
Absolutely.
one. Another thing, oh, sorry, go ahead.
I know I was going to ask you, like, on average, how much time do you get to spend with your patient?
So the average initial appointment for a functional medicine patient is 60 minutes long. And typically before that appointment, I'll request that patients fill out some detailed paperwork for me that goes over their history, their diet, stress levels, exercise routines, as well as sending me any of their medical records in advance. And I dedicate an hour before an initial appointment to actually review everything that patients give me before we enter into that first appointment. Because one of my pet peeves as a patient myself in the past has been providers not actually reading all of the forms and things that I
Yes,
took
I
valuable
filled it
time to
out.
fill out for
Why
them.
did I fill it out?
Why are you asking me the same question that
Yeah,
I already gave you? So just because I want patients to value my time, I also need to value their time. And I think that starting our relationship off on that foot really helps to build that rapport early.
absolutely. Go back to the key elements. You look like you had some more you wanted to talk about when I interrupted you on time. So,
No, not a problem. So, the other thing that I think is really valuable for delivering high quality functional care is valuing our practitioners. and basically making sure that practitioners have the time to complete the administrative aspects of delivering care, that they have the ability to seek higher education and different training courses to stay on top of something that's so rapidly evolving like functional care, because all of those things end up benefiting the patients too. And also pulling in practitioners, even in the functional space, which is very holistic and wide scope. Having practitioners that have different specialties, even within the subset of functional care, also can really elevate and enhance the care that patients receive through that approach.
Absolutely. Are there other key elements that you wanted to hit on that are helping you ensure a patient-centered approach?
No, I think those are the big ones, really quality over quantity, valuing the practitioners, and providing a nice container for healing, which includes those unhurried visits and providing people with resources and ensuring that you're meeting patients where they're at. I feel like sometimes, especially with the knowledge that we bring to the table, we sometimes feel like we know what the patient needs at any given time, but actually taking direction from the patients on how quickly they want to move, what they want to understand in more depth, what they want to be told what to do, really making the care delivery model very personalized also increases compliance with treatment plans as well as just outcomes for the patients, which is a win-win for everybody.
Absolutely. And my favorite part of functional medicine as a whole is the root causes, how you focus on root causes rather than just symptoms. So, why is that such an important focus in healthcare or should be in healthcare?
Yeah, absolutely. So currently in America, we have a sick care model of care, and we
Mm.
primarily use medications to manage chronic illnesses. And again, don't get me wrong, there's a subset of people and a time and place to use medications, but uh, I believe it was actually the US Center for Disease Control and Prevention did a study recently that showed that over 80% of people in their 60s and 70s took five or more medications on any given day. So, polypharmacy is a huge issue here in the US.
It
And
is.
unfortunately, despite best intentions with treating with medications, they often have unwanted adverse outcomes or unwanted side effects and could be really cost prohibitive for people, especially dependent upon whether their insurance will cover them long term. So I think just knowing our dependency on medications, giving people an alternative option for actually addressing the root cause of disease, rebalancing their body with the goal of not needing to take medications or even supplements long term. My goal with my
Right.
patients is ultimately to help teach them about their bodies so that long term, once we actually address what's going on, they're able to maintain their health with as little intervention as possible. And as well as that being a really empowering and positive thing for the patients, it also decompresses our healthcare system, improves healthcare costs, and just helps people stay healthy for longer.
How long do you typically follow a patient when you're looking at root causes and teaching them?
So Yeah, so it really depends upon the complexity of the illness that they're dealing with. And healing is not linear, especially in functional medicine care. Sometimes things get better quickly, which is wonderful. Other times there are setbacks that happen depending upon what's happening in someone's life. So, on average, the way that I work with patients under my membership plan model, which is for more chronic health support, it's for at least a year-long commitment to working with me because I found that that's typically the minimum amount of time it takes to really peel away the layers, understand what's going on at that root cause, and allow the spaciousness to layer on a treatment plan gradually so that it's not overwhelming for a patient, but it's
Mhm.
something that they can sustain long term.
What is a lot of times you mentioned ER when we first started talking, how you were in the ER. And, you get patients and they continue to come see you because you've taught them, but they don't actually do what you taught them to do. So, do you find that the patients that you're working with in the functional realm side of medicine, they're more willing to change?
Yeah, absolutely. So, Those are the patients that I actually prefer to work with. And that's actually one of the advice that I would give to any nurses who are interested in engaging in functional medicine care. It requires a lot of your time and effort, and who you invest that time and effort into makes a big difference in your work satisfaction as well as the outcomes for the patient. So I bake into my treatment plan and flow with patients doing a 30-minute free consult where I really get to gauge where they are in that stages of
Mm.
change of whether or not they're really open to making some of these difficult lifestyle changes to really get better. Because the practitioner can only help a patient so much. Functional medicine care, most especially, relies very heavily on self efficacy and the patient's willingness to change, to look at themselves in the mirror and to really understand how some of these behaviors that they have engaged in over the years, lifestyle wise, foods they put in their body, people they've surrounded themselves with,
Mhm.
where they've lived, how those different things could have actually led to some of the imbalance that they're dealing with. And that can be a really transformative and also painful process for a lot of people, that in order to grow, you need to kind of evolve and cut ties with some of these things you become used to over time. And I really want to ensure that the patients that I'm working with are ready to make those commitments before we begin.
Those are hard commitments. Those are really hard. For a lot of patients, that's been the way they live their almost their whole life.
Absolutely. And I feel like many people really love the idea of holistic care. It sounds
Yes,
really appealing. Oh, wow, focusing on my body and stress and diet and using herbs and supplements instead of medications. But ultimately, when we get into the implementation, I found that if patients aren't ready for that, it can be very overwhelming for them. And of
it's a
course, if I'm already
lot.
engaged in working with them, we
Yeah,
take it step by step. We break it into chunks. We try and really make it as digestible as possible for them. But ultimately, many things in life, especially with care and
mhm,
healing, come
mhm.
down to the right timing.
And it's a lot of work, and I think going into it, they have to know it's a lot of work. Holistic care.
It
So
absolutely is. And being clear with those goals before somebody gets started on that journey is really what
mhm,
helps set people up for success.
that's really good. So to help them with meeting those root causes and to set them up for success, what types of tools and methods do you commonly use?
Yeah, absolutely. So I often will use comprehensive testing after the initial appointment with patients, where we go over their history in detail and we start connecting the dots between how they're feeling now and certain things that predated them feeling unwell. I'll have more of a clear roadmap of what testing we should do to confirm or deny some of our theories on why they're not feeling well. And I encourage people to almost have a toddler like mentality of just keeping asking me why. Why is this happening? Like, why are we doing
Right?
this? Because I really feel like having people understand the why behind the testing, the treatments, also helps to really improve compliance.
Mhm.
And in functional care, in good news, even though my office is out of network with insurance, I can leverage conventional labs to do more functionally minded tests. So I look at things like vitamin and mineral levels, hormones, inflammation markers that can be run directly through patients' insurances and covered to the extent of their benefits. But I
That's
also have
nice.
access to some of the out of network tests that are
Yeah.
also more specialized, and they go beyond what we can run through insurance, like comprehensive stool tests, genetic tests, hormone metabolism tests, that basically just give us different ways of looking at a problem than what conventional providers can often test and interpret.
Yes, so I saw a functional med PA and she took 10 tubes of blood on my first visit. So I learned a lot about myself with those 10 tubes of
That
blood,
is
but
a
that was a
lot.
lot. I've never had that much at one time, but I learned a lot about about my health and things that were going on in my body. But I had asked my husband to please take me so that in case I passed out on the way to the car, had me a candy bar or
Oh my
something. But yes, what? Can you share some examples of where this patient-centered approach or where you were addressing those root causes led to significant improvement in your patients?
So, one of the areas of functional care that I'm very passionate about is digestive health, and most especially IBS, irritable bowel syndrome. There are some of these broad blanket terms that we'll use conventionally that basically don't really tell us why somebody is having symptoms, but it's a diagnosis of exclusion where this person has seen a GI specialist, they've had advanced testing like a colonoscopy or endoscopy to better understand why they have things like diarrhea, bloating, abdominal pain, food reactions. But all of those tests have come back normal. And
Mhm.
conventionally, people are just told, oh, okay, everything is technically normal. You don't have H. pylori, you don't have celiac disease, there's no inflammation. I think you're fine. And they're kind of left just having to manage some of these uncomfortable symptoms long term, or they're told to go on restrictive diets long term, like a low FODMAP diet to just manage symptoms.
Mhm.
And people can get really down and out about that, dealing with things like that every day. And I feel like digestive health issues is really where functional medicine care shines because we do not just leave diagnoses at IBS. We try and understand why somebody has developed digestive issues. And some of the main reasons why I see people who have IBS through the testing that I do are things like bacterial overgrowth in the digestive tract that can lead to unwanted symptoms, fungal
Mhm.
overgrowth that can lead to things like sugar cravings and bloating. Maybe they're not digesting their food well. Their stomach isn't producing enough stomach acid, or their pancreas doesn't have enough digestive enzymes to really break down that food, and that's what's leading to symptoms. Or maybe they're having an issue with motility, where food and stool are not going through their digestive tract at a healthy cadence, and that can be leading to unwanted symptoms like pain, constipation, or bowel frequency. So, taking that extra step, doing those additional tests, there are many different root causes for IBS. And that's part of what, again, makes functional care so fun because two or three patients can come to see you for the same blanket thing, like IBS. But depending on their testing, you're going to treat each of those people differently.
I love that you find that information, but if I go to the GI doctor, I don't normally find that type of information out. I
Yeah,
just you get the blanket
unfortunately,
diagnosis from them.
yes, you do. And I think that can be also something challenging for providers to navigate when you're working with a newer patient to functional care because they've dealt with a lot of healthcare trauma oftentimes, or they've developed healthcare anxiety from being dismissed from other practitioners, or doing these workups and being told that everything is fine. Uh, it kind of scars them and puts them up, has them put up these defensive walls or barriers that it really takes a special practitioner who can take the time to help them understand how your approach is different and how you're going to help them really understand what's going on versus just even if things come back normal, leaving things at that.
Can you talk a little bit about your training? I know you are a nurse practitioner, and then did you have to have extra training in order to go into functional medicine?
Great question. So, I graduated from NYU with my master's in adult primary care. And at NYU, there was actually a subspecialty for holistic nursing that I was able to take. It's one of the only programs in the US that actually has a holistic component to it, which was wonderful. And
Yes.
it really opened my eyes to different modalities of healing. And I was actually able to do my clinicals at functional medicine practices in New York City as part of this program. So that's part of how I got some of my fundamental training. But once I graduated from my NP program and got my first primary care and functional medicine job, I did also get certified independently through the Institute for Functional Medicine in functional medicine care. And that entails going to different conferences and training courses. You have to have a certain number of clinical hours and complete a board exam as well as a case report on functional medicine care that you need to pass. And even though functional medicine care right now, you don't need to be certified in order to practice it. It was really important to me just valuing education and valuing just some of these more objective markers of what actually constitutes as an expert to be able to tell that to my patients and to show them how I have been able to really hone my craft. And I think it gives them a lot of confidence in the care that I deliver.
Absolutely. I am a proponent of certifications myself, so I totally understand what you were thinking when you got your certification. But when you were going through your training, what did you see that was different between what you were learning outside of a holistic care model versus, just probably what the rest of most nurse practitioner programs are? I didn't even know that there was a holistic nurse practitioner program available anywhere.
Yeah, absolutely. And that's something that I'm also very passionate about. I have done a couple of speaking courses at different universities throughout the country to just basically provide nurses with awareness of this field of medicine early on in their career, because I had not heard of this when I was in my undergraduate
Mhm.
program by any means. And there really is a big discrepancy or different knowledge and skill set between the conventional training for nurses as well as the functional training. So, for example, in like my NP program as well as undergrad nursing, I think I had one nutrition course or one lifestyle course that really
Mhm.
talked about, which foods are healthy for people, how to manage diabetes using diet and lifestyle. And although that was a helpful course, it really was not as comprehensive as what's needed to practice lifestyle medicine. And that is a huge lion's share of the training for functional medicine. And for good reason, because 80% of chronic health issues here in the United States are actually rooted in a lifestyle issue. So if somebody is stressed, if someone's not sleeping, if they're not eating the right foods, if they're in a toxic environment. And again, you can use medications to help manage those symptoms, but ultimately, if you have the training to diagnose and implement a personalized treatment plan for these patients, you're actually able to help heal these chronic health issues without using medications.
And it's so interesting you mentioned a toxic environment because it's not just a toxic, like people think of mold or, allergies, but it's also like your stress levels. If you live in an environment where you're always scared or stressed, or, it also goes back to those mental aspects of your environment, which we don't really think about. And I had a functional medicine PA tell me, "We can go through all these things, but if you don't remove yourself from whatever this toxic or this stress is, it's not gonna help. We're not gonna be successful." And I think that's eye-opening in holistic care. Not just, "Here, here's a medicine for you," but, like, let's remove ourselves from that.
Wow, I'm so glad that someone spoke to you about that because you're absolutely right. Those, I think, are some of the more challenging spaces to navigate functionally because people might be more amiable to taking a supplement for something. But if you're telling them, maybe where you live is contributing to this, maybe your relationship or your job,
Yes.
is part of the toxicity and what's making you ill, that's a harder thing to be introspective about and decide to change.
Absolutely. What do you find in your patients that like let you know this person is ready to change? This person is ready to heal themselves.
Yeah, great question. So, um, I really see myself more of a steward of this type of medicine because I really do believe that patients know what's wrong with them and they have great body awareness of articulating why they're not feeling well. But it's part of my job to help them better understand the underlying reason why they're feeling unwell because they can tell you those things. Someone who's ready for functional medicine care has great body awareness. They've been tracking some of these symptoms themselves. They've been doing independent research. They're coming into my appointments, being an active participant in their care, asking me really good questions, critically thinking. And they're some of my favorite people to work with because it's so collaborative. It's
Yes.
not just me telling them what they should be doing. It's us engaging in this supportive relationship where we're both giving and taking. And
Mhm.
it again makes it really rewarding for me because as much as I'm seen as the expert in this field, I learn so much about functional care from my patients and new supplements, new research, because they are also keeping their feelers out and actively engaging with this type of care. Um, and they're also very good at communicating. So I do have some form of unlimited messaging with my membership plans with the practice. And part of the reason for that is I want to be an active participant in their care, even in between appointments, because there are things that can pop up in someone's life that are significant to share with me as their care provider, but it might not make the most sense to utilize visit time to discuss those things. And when patients send me little updates on how they're doing or something that they noticed about their body once implementing a plan, it just gives me even more knowledge about how their body's responding, how they like to communicate with me so that I can support them in the best way possible.
I bet you get to see so much success with your patients, and that just like brings joy to what you're doing because you're seeing that what you're doing is making a difference.
Oh my gosh, absolutely. It's one of the best, most fulfilling things. We call it graduating from the practice at Emergence Health, where
Oh,
ultimately people don't need to see me anymore. They can take care of their own health and wellness. And of course, I'll still be here if they want to check in at every once in a while, but they feel empowered and confident in taking it from the foundation that we've built together. And that can look like not having digestive symptoms anymore. That can look like having a healthy baby after having issues with fertility. I do a lot of things with women's health. That's being able to spend time with your grandkids and have good energy throughout the day for older adults. So it really is a fulfilling profession in that respect.
oh, I love that so much. Well, that concludes our first episode on the patient-centered approach in holistic health and functional medicine. We hope you have a clear understanding of how focusing on the patient and really addressing those root causes can lead to improved health outcomes. If you've enjoyed this episode, be sure to stay tuned for episode 2 of the series, where Leah and I will continue to delve into the role of nurses in functional medicine and the importance of collaboration and case management.
This podcast featured content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits. Take your learning to the next level by subscribing to more podcasts on compelling healthcare topics.